Okay, now we're going to go over the 5 questions that we did. So we learn from the question and also learn from our mistakes. Remember, the important thing is if you're thinking and processing properly, you will get the majority of answers right. But nothing guarantees you're going to get every question right, okay? But you'll get a high percentage. All right, so let's review them. All right, first question here. Oh, yeah, the person who had a stroke and can't remember, the blood pressure was 185 or 105. That was the key clue here because 160, once the systolic hits above 160, you're now outside of autoregulation. That means autoregulation is impaired. So because I understand that, what I do, I start looking for an answer that says autoregulation is impaired. And notice B is the one that says it the best directly. Autoregulation is impaired with pressure, passive cerebral blood flow. And then, of course, you can always read through the rest of the explanation if you like. So we're going to go to number 2. This was the Guillain-Barré syndrome. And we said because it's autoimmune, every autoimmune disease says that there's got to be some molecular mimicry. Just remember that. The conceptual thinking is so accurate, which means you don't have to know every detail, but you got to understand the idea. I always tell students that an idea will get you 9 out of 10 with not too much problem. All right, so answer A is the only one who says molecular mimicry. The other ones are saying all kinds of other things, but they're not saying that there's anything about that bacteria and your cells or your antigens. All right, so we pick letter A, and that's why we got it right. All right, we go to number 3. This was a person who was taking carbidopa-L-dopa and would have about 2 to 3 hours of increased control, and then it would wear off. That tells you that you're getting a pulse or an increase in the neurotransmitter, dopamine, because you gave it a dopamine precursor, which makes sense. And so that's why they were out of control for a while, and then it wears off. Okay, part of this off-on phenomena that we see in Parkinsonian patients. So A, if you see when you look at these answers, is the other one that says there's a pulsatile dopaminergic stimulation causing altered striatal gene expression and receptor sensitization. Now, there's a tendency to try to figure out every detail that they have in a question. I don't do that. I always recommend folks, which one matches the idea that you have in your head? Now, whichever one matches that idea is the answer you're going to pick. Again, highly accurate, but never 100% accurate. All right, the next one. This was the person with the temporal lobe seizures. All right, who started out with problems on one side. The right side had scarring, and then you notice there's a problem on the left side as well. And this is something that's characteristic of temporal lobe seizures, is that they can actually depolarize to the other side. All right, and so C is the only one that says that. If you look at, like answer E is talking about developmental anomaly, we never mentioned that. D is medication effect, we never mentioned that. And then B is functional reorganization, doesn't say what I want. And then A is talking about cross-cerebral dominance, we never said that. That's why it's so important, folks, to be able to talk it out. Don't just stare at the answer and say you're going to know when you see it. Students say that all the time, and I've had a student in 30 years prove that statement is correct. They recognize 1 or 2, but then they miss a whole bunch of questions, folks. So don't do that to yourself. Follow the rules in test taking, and you'll get a good score. The last question. Oh, this person with the CGRP drug, erenumab. All right, we said whenever you damage any part of your body or any tissue, then other cells in that tissue or organ will try to increase their activity to try to make up for it. That's called compensation. That's what you expect, and that's what's going on here. If you block one pain pathway, then the other pain pathways will upregulate. This happens acutely when you first start a medication, and we expect it, and usually it dies down after a while. It's important to be able to explain things to patients when they come in asking you questions about what's going on. So notice, by following the 5 steps, folks, you get most questions right. Don't deviate. As I always tell students, don't deviate. Okay? Follow the rules, and if you do, you'll get the majority of answers right. And you will see so many times only one answer has the keywords that addresses the idea that you have in your head. Remember, the key is to get the questions right, and follow the rules will get the majority of questions right. And that way you're going to pass that exam. All right, good luck to all of you.